Hi, this is Vikram Chopra. I'm a student of Fitchburg State University. My student ID is FS195789, and I'm presenting today as part of my selected topics course. And my presentation title is How to Decrease Claims Cost for a Regional Healthcare Insurance Company as part of my final presentation. Okay, as the topic sounds, I am presenting a case study where one of a healthcare insurance company A, which is struggling with increase in its administrative cost every quarter to run the company. That's about the background information of the company. Company has been receiving recently from last 2 years huge number of high dollar claims, which is impacting its profit margins as the company is small in size, and having high dollar claims uh, impacts its profit margins hugely. um, so, for example, if the company is receiving a $10 million claim every month, which is $10 million, and based on company size, that could be a lot of money. Along with that, companies are also facing huge competition from various national insurers like Cigna, Aetna, United Health Group, and it is making very difficult for the company to survive in a marketplace. Uh, and based on that, company's leadership has decided that as part of their strategic decision, they need to cut the costs uh, of their company to stay in the market. But to do that, they want to know where the company is incurring maximum cost and what kind of programs they can implement to reduce the cost and increase profit margin. Uh, that question is very important. I need to know where to cut the cost. If I do not know where the maximum cost is happening and whether that cost is reasonable or not, I cannot decrease my spending. If I cannot decrease my spending, I literally cannot increase the efficiency and increase my profit margins for that organization. So the company based as it's a health insurance company, I am presenting a graph that shows how various organizations have been doing. The large scale organization in US are doing from year 2015 to 2018. This data was captured from public resources through internet, and this graph displays how they have been doing in last 3 years. If you say they are doing pretty well, but this company is not doing that well, because it's a smaller size company. So the data, from where we can get that data, which can tell the company where cost can be saved. As it's a health insurance company, they get medical claims, hospital claims on daily basis, right? So company has a lot of claims data that can tell them where the majority of costs have been incorporated in last 2 years. So all the claim data that is in their core claim adjudication system uh, is available in a backend database, which can be used to do various kind of data analysis, right? In that claim data, company can determine which population is using the health services more as compared to others. What it means, it means is that I need to identify the patients or members of my insurance plan and what kind of those members are using health services more, where the utilization is more. So that would become my focus area to implement newer programs to decrease healthcare cost, or to implement programs which would help them shift the healthcare spectrum. So what healthcare spectrum means? A healthcare spectrum is basically you want to make sure you make your members move from one expensive place to a lesser expensive place. It's not a complete shift, it's just a one shift backwards. So for example, if a patient stays at home, it costs you less as compared to if they go to a primary care physician. So if somebody who goes to PCP a lot, The program should uh, help them stay at home from a treatment perspective by giving them telemedicine or nursing facilities at home, which would reduce the healthcare cost. Or if somebody is going to PCP, right? So we do want to make sure, if somebody is going to urgent care, we want to make sure they go to PCP, because if you go to urgent care, it costs more for an insurance company to pay for those claims as compared to if you go to your primary care physician. So one shift, not like major shift, just a one shift backwards uh, would really help the organization determine where the cost could be saved. The medical claim is the data where the organization can determine where majority of the cost could be saved. Also, the company needs the data to know where which population they need to target, and which kind of programs they need to implement. Obviously, company as a healthcare insurance company has been running various kind of programs in the last 3 years to save money, but they need to understand which programs in past 3 years have been successful in saving money and which programs have not been successful in saving money. So this kind of data they can get internally from programs KPI data, which is key performance index data from the program committee. Most of the companies programs also have surveys which basically are collected at the end of the program from participating population, so that could also help them determine how these programs are doing. And also the net promoter data, that's like an industry standard data that you get from your members, how your healthcare insurance company is doing. That can also give you an insight where you are struggling and where you are losing to your competition. So obviously all of this data is needed to give to answer company's strategic question: what do I need to do to save money and to increase my profit margin? So all the medical and hospital claim data for the membership is very important to determine where I am incurring maximum costs and what I need to shift that healthcare spectrum to one step backwards, right? I do not want people to go to emergency rooms. I want to them to go to their doctors, and maintain their health, so they do not end up being in ER and send me $1 million claim, rather than if I can adjust that in a couple of $100 of claim, right? And that is also easier on the patients and the members as well. It's not easy for anybody to go to ER. It's easy if they go to a doctor and have their visit and get treated over there, right? So from a medical and claims data, I can do some sort of predictive analysis to determine what kind of conditions are prompting members to utilize health services more. So for example, if it's a growing population in the area, seniors, right? They are the biggest consumer of healthcare services, right? So that could be one thing. So I need to make sure I provide them some sort of nursing services at home, which will help them reduce their cost, right? Then I need to implement those kind of programs and make sure they become successful, helping nurses seniors adhere to their medication programs, right? So they do not their medications, like for diabetes, for high cholesterol. If they miss their medication, studies show that they can end up in ER, which could have been prevented. So all of this data is going to help me answer my question. And along with that, I need to put a check on these programs to ensure that I am maintaining a continuous uh, feedback on these programs from the population, how my programs are doing. It cannot be that I'm starting a 1 year program and I do not get any kind of feedback for 1 year. I have to work in an agile fashion where I'm getting feedback every couple of weeks to ensure that my programs are right on the line to reduce that cost. So basic data analysis from insurance claims would help me achieve my targets. Thank you. Thanks much. This is Vikram Chopra again. Bye.